Canine, and
Joanne from For Better For Worse. And
and today we have a guest that is joining us. Her name is Dr. Rosemary LoGiudice. Many of you that are in the area know her very well. She's a wonderful animal rehab veterinarian and educator and barn hunt competitor with her dog Otter. So I'm going to let Rosemary kind of introduce herself and tell us a little bit more about her, and we'll get going for the night. Rosemary.
Excellent. Thank you, Nancy. Joanne, very nice for me to be here. I'm real happy. I graduated from the University of Illinois in 1981, and the first 20 years of practice, I did primarily equine medicine and surgery and a lot of sport and activity like that with horses. Went to work for the American Veterinary Medical Association for about 8 or 9 years, and then went into rehabilitation. Thought that was just something that just always interested me. I mean, it's what we did with horses, getting them back to whatever sport that the horse had to do. Then I also got certified in acupuncture and in spinal manipulative therapy, which a lot of people know of as chiropractic. But the veterinary spinal manipulative therapy is based on functional neurology, which is, to me, really, really fascinating, even though I absolutely hated neurology when I was in veterinary school. So it's changed the whole way that I look at animals and how they move. And sometimes it has almost ruined me going to watch a dog sport or a horse sport, because I still do spinal manipulative therapy on dogs and horses, because when they're not moving quite normally, I want to know why. Why are they moving like that? And is there something that's going on with them that is causing them to not to move correctly? I know Nancy and I talked a little bit in the past about people thinking that there's always training issues that causes a dog to not want to participate in its activity. But the first thing I try and tell people to look at is see if there's something bothering them physically. And when you think about it, the nervous system rules everything in the body. And so that's what is important, to make sure that that nervous system functions, because bones are stupid. They don't do anything that the muscles don't tell them to do, but muscles aren't a whole lot smarter, because they need the nervous system to trigger those muscles to function and to go in that ballet that's required for every muscle to fire for the dog or the horse to move appropriately.
All right. And that's why this is one of the reasons why I was really excited to have you on, is because in our work in training, we do see a lot of dog locomotion problems that a lot of people say, oh, he's just being stubborn. He doesn't want to sit, or he doesn't want to lie down, or he doesn't want to. And usually many, many times there are physical issues that can be handled and taken care of. And that's why I wanted to have and I am very big with my own dogs on chiropractic. And Rosemary personally helped me with one of my young dogs. He had a very long hock and a weak rear, and he's doing great now with a lot of rehab and underwater treadmill. So it's really been very helpful. So for the format for tonight, we have some questions already for Dr. Rosemary, but we want you to ask some questions too. So we will be fielding those questions as best we can, because there's so much information to cover in such a short time, but we're going to try to kind of get there and answer all your questions. And also we're going to have Dr. Rosemary start with a little bit of information about COVID-19 and dogs. There's a lot of misinformation out there about the situation with the illness when it comes to animals. So I wanted her to start her, before I start asking her questions, to talk a little bit about that with the dogs, so that we can all be more clear about what the reality is and what the truth is about. Dr. Rosemary?
Yeah, and that's really important. And it makes me very sad when I see on the news that people are giving up their pets for no apparent reason, for thinking that that the animal's going to get sick, they're going to get the animal sick, the animal's going to get them sick with the COVID-19. And the most current information that we have, and I use the information that comes from the American Veterinary Medical Association, and you can go online to avma.org and look up and see what their information is. There's lots of misinformation out there and people talking about things that don't need to be, that aren't correct. And so they're doing things that they don't need to be. But right now we know of 2 dogs that were in Hong Kong and a cat in Belgium that reportedly were infected with the SARS-CoV-2, which is the COVID-19, but they don't think that the animal had the disease itself. They swabbed and found the virus. So these animals were owned, as far as we know, were owned by people that had active infections. So perhaps the virus was just on the animal, in their nasal passages from breathing it in. We know that the virus can, if you sneeze on your dog, you're going to get the particles on their hair or what have you. But the animal themselves were not sick, as far as we know, from these reports of these 3 animals. So basically, using good hygiene. Wash your hands. If you're going to be petting your dog, make sure that your hands are clean. Wash your hands after you pet your dog or your cat. And, just use good common sense hygiene, which I think sometimes we've lost sight of good common sense hygiene. So we need to do these things. We pet the dog, wash your hands, and then just use good common sense. If you're going to kiss your dog, just use common sense. If you've got a cold, maybe you don't want to be kissing the dog. So at least not for that period of time, right?
Exactly.
So just good common sense and use an abundance of caution. If you've got a service animal, just make sure that everything's clean and you use good hygiene.
All right. Well, and that's I just wanted to be clear on that because there's so much misinformation about that. People are starting to get so scared. And I think we're just starting to become so hyper aware of every little thing that I think we're just getting a little bit more stressed out, and some of our animals are paying the price for it. So
Exactly.
To get started for tonight, what I wanted to talk about, what is the best way, because sometimes we have students come to our classes, and I know Joanne sees it as well, that the dog isn't moving well, and I ask, hey, how's the dog seems to be having this issue, what's going on? And a lot of people didn't notice it. So I guess my question there is, what's the best way to really keep on top of watching the dog's structure or checking out what other maybe orthopedic issues that might be going on, that maybe from a hard play, or they were somehow ran, or they slipped, that maybe we don't notice it, because we don't notice them a lot of times because we see them all the time. We see them always. What are some of the best ways we can stay on top of our dog's structural and orthopedic health?
Well, one of the things that I recommend is that you do a video recording of your animal about once a month. And this would be like a structural. Have them stand, get a picture of the animal from each side, from the front, from the back, standing maybe on a little platform. And then there are some basic little exercises that you can do to just kind of see how your dog's strength is. One thing is just to have the dog stand, lift one front leg. How well can the dog balance on 3 legs? Write that down, or even record it.
Mm-hmm.
Do the other front leg, do each hind leg. Do this once a month. If you see a change in how the animal is able to, a change for the worse, that is, on how long maybe the animal can balance on 3 legs, then perhaps there's an issue, and that may show up before the dog actually starts to show a lameness, because little subtle weaknesses can be detected in this way, and they'll show up before the dog is going to show you a lameness. And of course, in my world, doing the spinal manipulative therapy periodically, the motion palpation that we learn in the spinal manipulative therapy, get very subtle changes in the mobility of the joints before any kind of problems are showing up. So that I also recommend, especially if the dog's doing any kind of athletic sports, that you have a good evaluation by someone well trained in veterinary spinal manipulative therapy, and that then you do have periodic checkups. Some of my patients, they have very few problems. Maybe I see them quarterly. Then maybe I see them once a month. It depends on what the animal's doing and what's going on. But the video recordings of how the animals stand and how they're able to, those kinds of things, in my opinion, can be very invaluable.
Sorry. All right. Wonderful. Okay. So those are really, I had remembered you had mentioned that before, just so we can keep an eye on the dogs, chiropractic and structural health, because that is, and it's something that we don't really think about very much. Especially, I think about it a lot because I have an older dog, so I'm always watching her, what she's doing and how she's moving. But I don't pay as much attention to my younger dogs as I should.
And one thing that I'm going to harp on is toenail length. That's one of the easiest things that people can do, and sometimes it's overlooked. You've got to maintain those toenails very short. You don't want to hear any clicking on the ground, because if those toenails are coming into the ground, that's going to make the dog rock back, almost like he's climbing hills all the time, because those toenails are not allowing him to stand upright on the leg like he should. Those toenails are hitting the ground, and so it rocks that dog back. So you've got to keep the toenails short. If you don't, you're going to get, in the front legs, you're going to get problems with their carpus or the wrist, and that's going to cause the dog to have big time issues. So toenail trims are easy to, well, some dogs are easy to do, but it's something that you can do readily, easily, and maintain some good structural health for the dog.
And the funny thing is, those of us that have been home more, we've been doing a lot more nails lately. So the dogs are mortified, because everybody's nails should probably be in great shape, because I know I have been doing them a lot more often than I usually do, because I'm home to do those. So yeah.
Yep.
Okay.
Yep.
So this is a longer.
Can I ask a question real quick?
Yep.
Is that something that can actually cause long-term damage?
Yes, it can cause, one of the biggest things that you'll see from that is hyperextension of the wrist on the dog. You know, when you look at the dog standing on the front leg, they should be pretty upright from the elbow joint down, and that wrist joint should be pretty straight. If the wrist joint looks like it's kind of, I'm going to try and do it, bent back, that's what happens if the toenails are too long. And if that keeps happening all the time, you're going to stretch these tendons, the flexor tendons on the back part of the leg, and you're going to lose that proper alignment. So maybe the dog had good conformation to begin with, but now you're causing a problem where structurally the conformation is no longer as appropriate as it should be.
Oh, yeah, that's good to know. And it's hard because, and those of us that have dogs that don't like it, it's not as much fun. But this is, you always got to see the silver lining in things, and being stuck at home will give us an opportunity to work on getting them to enjoy it a lot more. I know my lab is not really a fan of getting her nails done, but she's gotten a lot better the last few weeks because we've been doing it more often.
There you go.
Yeah. All right. So the other question I have, and again, everyone, if you want to have questions or you have a question, please feel free to put it in the comments, and we'll get to those as soon as we can. The second question I had, I know a lot of people do a lot of different sports. I've done agility in the past, barn hunt, fly ball, rock diving, and nose work. And I know for nose work especially, a lot of people don't think that the dogs need to be physically fit. So I wanted you to address, what are some of the necessary physical requirements for any or all dog sports, or some of the basic things that they should have for all the dog sports, and maybe other specific ones for the different dog sports. I know in agility, people are a lot more people are a lot more focused on the whole chiropractic, but some of the other sports I don't see that as much. So I was wondering what your thoughts were on that.
Yeah, I think in my opinion, I think the chiropractic or the spinal manipulative therapy can benefit everybody. benefit all the animals, and at least a checkup to see if there's any kind of restrictions. But I think one of the biggest things that a lot of people overlook is core. And I think the core muscle strength is extremely important. If you don't have a good core, a good abdominal muscles, good iliopsoas muscles, good muscles that are on either side of the spine to help support the trunk, then that animal is not going to be able to perform as well as it should. Think about us and our core strength. If you're trying to do something and you've got minimal core strength, you're not going to be able to breathe well. You're not going to be able to move well. And just improving core strength without necessarily having to do a lot of other exercise can be extremely beneficial for circulation and breathing, which I don't know about you, but those are two things I think are pretty doggone important.
Yes, they are.
And there's some easy things that can be done to strengthen core. One of my favorite, balance exercises is having a dog stand on like a couch cushion and just kind of have the dog rock back and forth, and they have to kind of balance themselves. Even an older dog can do that as long as it's just a nice low couch cushion. You're not asking them to do a lot of physical activity. It's not high impact. Another thing that's a really good core strength that you can work them up to is that what I was talking about with checking the dog's strength, lifting one front leg, doing a three-legged stand, one front leg, the other front leg. If they can do that easily, you can progress to diagonal leg stands. Lift one front leg and an opposite hind leg and see how well they can balance. That's really stimulating the core. Of course, it has to be done, and you have to support the leg carefully so you're not putting stress on the knee joint, which is probably the one of the biggest. If a veterinarian that wanted to do surgery wanted to specialize in one joint, they probably specialize in the knee and make a nice living for themselves, because unfortunately cruciate ligament issues are a problem. And if we don't have the muscles that are strong that support the joint, you're asking the ligament to do all the work. And so any dog can get cruciate ligament injuries, whether it's nose work, whether it's dock diving, barn hunt, or going out for a walk. Squirrel is probably the primary cause of cruciate ligament tears. The dog is standing there and all of a sudden, squirrel, and they twist, and repeatedly twisting that knee joint causes that cruciate ligament to gradually weaken until finally it either tears or partially tears. So core strength, strengthening the muscles that support the joints are really important.
Okay. All right.
So Aaron's asking if a wobble board can be used to build some core strength.
Yes. It depends. Again, it depends on what the dog's physical abilities are. You wouldn't want to put your 13-year-old golden retriever who's not done anything on a wobble board and start wobbling them. And there's a difference between a wobble board and now I forgot, the word left my mind. The wobble board moves in all directions, and then you get the board that just tilts back and forth. Oftentimes on our dogs that may not be very strong, we're going to start out with the board that just tilts back and forth so that you're not challenging the body in all directions. That might be too much for them. And you might actually be putting stress on the joints because they're trying to balance themselves in too many directions. And if they're not strong, you could cause an injury. The same with using some of the balls, the Theraballs, or the blow up peanuts. You've got to be careful to start out with. I've seen some videos online where the person goes, here, let's put the dog on this big inflatable peanut and watch him balance. That's asking too much if the dog's not used to that. You've got to work up to things. But I like wobble boards a lot to help build core strength, definitely.
Yeah. Well, and we have.
So one more question on core strength. I know many years ago it was said you should do the sort of sit pretty and have them balance. And I have heard many a story that can put a lot of stress on the back muscles and the sacrum. Can you talk a little bit about that?
Oh yeah, let me get on my soapbox here for a minute. Okay, so there was a big discussion, especially a couple of years ago, on the Rehab listserv. And there was one person in particular who came on and said, that's the worst thing you can do. You're putting too much stress on the dog's spine and on their articular facets, on their discs. You're hurting the dogs. It's terrible. So another person came on and said, okay, if you watch a dog that's out in the field and they're chasing a squirrel or whatever, and they're chasing the squirrel and the dog goes up the tree and he's basically standing on his back legs trying to get to that squirrel, right? They do that on their own.
Right.
Are we asking the dog to sit pretty for an hour and a half at a time? I hope not. I myself like the sit pretty. Done appropriately and on a dog that has appropriate core strength, it's a wonderful exercise. Now, if I've got a dachshund that's had back issues, had disc problems, am I going to ask that dog to sit pretty? No. That would be malpractice practically if I were to ask that kind of dog to sit pretty. So again, you have to know the dog, know the condition, and work with someone who's appropriately trained to give you the ideas and the exercises that are appropriate. So that sitting up, sitting pretty, you ask them to do it for 20, 30 seconds.
Right.
You may have them sit up and challenge them with a little piece of food so that they actually move back and forth while they sit pretty. You can even get the dog to go from the sit pretty to the standing position and then back down to a sit pretty. Now that is probably the ultimate in core strength and rear leg strength. Am I going to ask a dog that has cruciate ligament issues or weakness of the hind leg to do that exercise? Not to stand up and back down, of course not. That's going to cause injury. So again, I like the sit pretty done properly. I don't think it's going to cause issues, providing it's done in a dog that has worked up to that challenge of exercise. It's like, I'm not going to go out and run a marathon tomorrow. In fact, I'm probably not going to run unless somebody's chasing me. But that's me. And you've got to use good, responsible understanding of what the dog can handle.
Right. And I think
great question though.
Yeah, I think it's one of those things that people, the dog, you know, it's especially as a dog gets a little older, it's really, really challenging for people to admit that maybe my 12-year-old dog can't do that, but maybe my 2-year-old, we can maybe work to that. And you can still challenge and exercise an older dog, but just in a different way. So really thoughtful about that. So
let me tell you one quick story, especially for those of you who know Otter. Many years ago, when I was studying the spinal manipulative therapy at the Healing Oasis, I was studying at the kitchen table, and this was probably one of the most challenging courses I've taken, other than going for boards. And I was also in the process of, I'd been trying to teach Otter to sit pretty, because I'd been working with Dr. Chris Zink, and she said, that's a really good exercise. You should do that. Okay, fine. I try and get him to sit pretty, he'd fall over. And I get him to sit pretty, he'd fall over. I'd try and hold his paw, he'd sit pretty, and then as soon as I'd go with paw, he'd fall over. And I went, Darren, I can't get him to sit pretty. So I'm studying at the kitchen table, and I'm ignoring him because I'm studying. And all of a sudden I realize I don't hear him. And I'm thinking, oh, this isn't a good thing. And out of the corner of my eye, I look, and he's sitting next to the table, perfectly sitting pretty on his own. And I was like, what a good dog. Oh my gosh. And I gave him all kinds of treats. And then that became his go-to. Anytime he wants something, sit pretty, I can do that.
Oh my God, that's awesome.
And he was probably 5 by the time he did this. They went, oh, is this what you've been wanting me to do all these years? Yeah.
It's true though, because sometimes you're like, well, I have to tell you, I had the similar issue with the retrieve with Tango with my shepherd. I couldn't get him to retrieve it, couldn't get him to understand that. I'm like, geez, I wonder why it's so hard for him, because my girls, it's so easy for them. One day he picked up a toy and brought it to me, and I'm like, oh my God, what a good boy. And that was it. he retrieves everything now. And it's,
Yep, positive reinforcement.
yeah, it was pretty funny, but yeah, it reminds me of that. Okay. And let's see. Oh, I wanted to ask you, I know we were talking earlier about uh, some of the injuries that that can be sustained with some of the sports like dock diving, and what to look for. What are the more common injuries in the different sports, like agility? I know cruciate is a big one, because I know a lot of dogs that have had that from agility and all that. But since some of the other sports like dock diving and barn hunt and fly ball, is it the same? Is it cruciate, or are there other potential injuries for the different dog sports?
Yeah, that great question. I think cruciate ligament, any dog can sustain a cruciate ligament injury. In dock diving, probably I see more neck injuries and back injuries depending on how the dog lands in the water. If they're doing just the long jump, and say the dog lands all stretched out and they hit the water flat, and that head hits the water, boy, you get I see a lot of cervical injuries, and also TMJ, the temporal mandibular joint, the jaw. Depending on how the dog hits that water, it's hard. I mean, water, if you've ever done a belly flop, you know that hurts. You enter the water wrong, and it hurts. Dogs that do the dock diving, and if they land in the water and don't tuck the hind legs underneath, like the ideal landing position, say the legs are all sprayed out behind, then when they hit that water, they're going to actually hyperextend that back, and I see lumbosacral, so lower back, lumbar, and I see a lot of injuries in those areas from hyperextension. But again, cruciate ligament can happen. They're running down the dock. If the dock is wet and they slip, or they slip as they leave the dock and launch, you can get cruciate injury. You can also we're seeing more shoulder injuries in some of our athletic dogs. Medial shoulder syndrome. I think years past, a lot of people, we used to say in the veterinary world, oh, you have a biceps tendon injury. And so everything in the shoulder was a biceps tendon injury. And I think that's because it's relatively easy to palpate the biceps tendon. And we really didn't have very good diagnostic tools back then. Now we've got musculoskeletal ultrasound. I love musculoskeletal ultrasound. We can actually image these tendons and see, is it a biceps tendon? Is it a supraspinatus, infraspinatus? Is it a teres minor injury? Is it a teres major injury under the armpit? There's lots of injuries that can happen with that shoulder, and usually those shoulder injuries are if the dog pulls that shoulder out or abducts that shoulder joint. You'll see that a lot, like in fly ball. Depending on how the dogs hit and turn, you'll see it in agility, depending on how they come down, say the dog walk, how they come off the teeter and turn. Dogs in weave poles, how are they coming through the weaves? Are they hyper abducting those shoulder joints? So I see shoulder joint issues. Agility dogs, a lot of people overlook the toes. Get a lot of toe jams. The dogs come down the dog walk. Or down the A-frame and jam those toes into the slats. Or if they've got the units, I think in Europe they don't use the slats anymore. But when they run down, they're still going to, if they're trying to kind of brake and slow themselves down, they're going to jam those toes. So I see toe injuries, and a lot of times people don't think about looking at the toes. So I find it very important to teach people how to just kind of mobilize those toe joints for their dogs when they're warming them up and after they're done exercising. What other things? Iliopsoas strains. We see that a lot in the back leg. The iliopsoas muscle is very interesting. It goes all the way from about where the diaphragm is up in the thorax, goes up underneath the spine, and ends up in the upper part of the upper leg bone of the femur.
Mm-hmm.
So it's a huge long muscle. In the person, it's two muscles. It's the psoas major and the iliacus muscle. And in dogs, they're pretty much fused. So we just call it iliopsoas muscle. But dogs that have a strain of the iliopsoas muscle, they're going to tend to be kind of a humped back, arched back, because they don't want to stretch that back leg out, because that would pull on the iliopsoas muscle. Also, these dogs, and so they're going to look like they've got a back injury, but it might not be the back, it might be the iliopsoas, or vice versa.
Yeah.
And some of these dogs with iliopsoas issues, they may not breathe well, because if they take a deep breath and expand that diaphragm, it's also pulling on the iliopsoas muscle, because that iliopsoas originates right about where the diaphragm originates. So some dogs aren't going to breathe well. And so now you've got to figure out, is it a breathing issue? Is it an iliopsoas issue? Or is it a back issue? So that's something to look at in a lot of these dogs that people sometimes don't know about or forget.
Yeah.
So Eddie has a question here. Her Brittany loves to run, and somebody's been really hesitant. She heard that there's been some serious injuries in that sport.
Fast cat.
Oh, fast cat. Okay. Yep. 100-yard dash, it depends on the surface. There have been some fast cat competitions that I've been aware of that were actually on a little bit of a downhill slope and wet grass. You add those two things together, and that's not a real good footing and a good situation for dogs to be running. I think if the dog, again, have they been conditioned for fast cat, or do you take the dog that you've done nose work with and say, oh, we're going to do fast cat today and run a 100-yard dash.
Right.
Yay. Maybe not the best choice. So again, you have to condition. Or a dog, barn hunt for a sport. It depends on how the dog does barn hunt. I've seen some dogs that do barn hunt, and it's like a leisurely walk in the park. And when they go through and, oh, there's a rat. Oh, there's a rat. And then you get other dogs that are like, they're jumping and running and flying all around the ring. And they're turning and twisting. That's a very short burst of energy and lots of twisting and turning, and not a straight line 100-yard dash. So you've got to condition the dogs. I've done fast cat with Otter, and he enjoys it, but we do a lot of running. He does, I don't. And
right.
And to get them conditioned. So you can't just do a weekend warrior with fast cat. But if the dog's conditioned, I don't see a problem. It's like anything else. They can get hurt jumping off the couch.
Yeah.
So
that's true.
You can't bubble wrap them, but you have to condition them properly.
Right.
Okay. And Marilyn asks us, if a dog has a medial shoulder injury as a youngster, is there more of a chance of a shoulder injury as they get older? I think that'd be true of any kind of muscular injury, right? How likely are they to injure that in the future?
It depends on what the injury was, how it was repaired, and then what the rehabilitation process was afterwards. Because I know of dogs that have had medial shoulder instability. They had surgery done, and and a couple of dogs that I can think of actually went out to Dr. Sherman Knapp at VOSM in Maryland and had him do the medial shoulder surgery. They've went through the very rigorous rehab program, and they're back doing agility again.
Oh, wow.
I've seen other dogs where they had a medial shoulder injury and they were just rested, and then periodically they re-injured themselves because it just has never completely healed, or the injury was such that it's not going to completely heal without surgery. So there again, it has to be it has to be evaluated properly.
Mm.
Okay. And then Aaron's asking, can you recommend a good warm-up exercise before running, say, agility or other sports? Do you have anything like as an overall warm-up to do?
You know, I like doing warm-up exercises that the dog does. I don't like necessarily a person stretching the dog. I see a lot of people stretching their dog. Unless you know exactly what you're doing, by stretching and holding a leg, you can actually fatigue a muscle instead of warming it up. So if you're fatiguing a muscle before you want to go for a burst of energy, you're prepping the dog for injury. So what I like to do is little exercises that might mimic what the dog is going to be doing in the ring to warm up the muscles that they're going to be using. So if they're doing agility, if you can have them do things like maybe jump over your leg, little jumps, walking them around, moving them, put your leg out so that the dog goes up and over your leg to get them those muscles started that are going to be propelling the dog over the jumps. Moving them around, walking them. I think one of the worst things that people do is take the dog out of the crate and into the ring they go. You've got to be moving them around. I like walking in circles, maybe having them come up, put their paws up on your arm to stretch. Let them do the stretching. Let it be an active stretch that the dog is doing rather than you try and stretch the dog's legs. I like the diagonal leg stands to just try and get the dog to warm up those core muscles. That's another thing that I really like. And I like cookie stretches. Have the dog with a little treat and have them stretch the head from each shoulder to shoulder, hip to hip, down on the ground, up and forward, so that you're really getting them engaged and warmed up before they go into the ring. Those are just a few things that I like.
Mm-hmm. And that would be good for that would be for long back dogs too, right? The dogs that have had back issues, that the cookie stretches, right?
Yes. Yeah, I love cookie stretches. I think they're done properly and nice and slow. Don't get crazy with them. I think they're a great exercise for stretching the muscles, warming the muscles up, and even cooling them down. And appropriate massage. There's different massage techniques that can be used to warm up a muscle and cool down the muscle. So I think learning some good massage techniques is also beneficial for our sporting dogs.
All right.
Okay.
Go ahead, Joanne.
And then Karen, I hope that answered your question. If it didn't, let us know. And
Yeah.
Lori asked, is there any benefit to having dogs walk backwards?
For a warm-up.
Oh, I love that.
For a warm-up.
Lori, I'm glad you mentioned that. Backwards walking is one of my favorite exercises. It engages muscles of the hind legs and back that the dog doesn't often use on their own. I also like sidestepping, having the dog step sideways. It helps to engage the muscles that help to bring the legs in so that you don't get the dog splaying out. So I like sidestepping exercises. And I love backwards walking. I think backwards walking is great. Backwards walking uphill, trying to teach the dog to go back and even have their back feet go up the wall on the real advanced dogs. That can be a really good exercise as well. Again, depending on if they have back issues or not. Don't want to do it with a dog with back issues.
Right. So Yaz was asking what are cookie stretches, and did you go over those again?
Yeah, so cookie stretches, if you've got a little treat and the dog you can do it with the dog standing. And so you bring treat and then have the dog bring the treat to one shoulder and then to the other shoulder so that the dog is moving back and forth. Then as they get advanced, you can bring that treat around to a hip without the dog turning around. So sometimes you might want to stand over the dog so that the dog is between your legs. And then that way, then they bring their head around your legs to their hip, to the other hip. Then you can also bring it so that their head comes down in between the front legs to round that back and stretch it. One of my favorite exercises is the dog's seated and you do a seated cookie stretch so that the nose, head, neck, back, butt are all in a nice straight line, and the dog is
Oh,
stretching without standing up. And then you can progress to where the dog kind of just starts to bring his butt off the grill, and then have him sit back down again. I like that cookie stretch as well.
oh, that's a good one.
That answers with my hand, with my Italian hands telling you what we're doing.
Yeah, that's okay. I know.
And one more here. What are your thoughts about dogs as running partners? Dirt, grass, mostly pavement?
The mostly pavement I don't like. Mostly pavement is very, very hard on dogs. A lot of concussion on the dog. Again, if the dog is conditioned, I think running partner on soft surfaces is good. Shoot, people running on mostly pavement is not
Yeah.
a good thing. So,
Yep.
and people are wearing all kinds of hundreds of dollars worth of running shoes to try and protect their feet and legs, and they're still breaking down. So, and in hot weather, I really don't like dogs as running partners in hot weather. They can't cool themselves off. Dogs can only cool themselves primarily by panting. They can sweat a little bit from their feet, but not enough to cool them off. And so in the hot weather, I see people out running with the dogs, and the dog's tongue is hanging way out, and the end of the tongue gets this shovel-like appearance. And when that happens, when that end of that tongue gets real broad and wide like that, that's a dog that's really overheated, and they're trying their best to cool themselves off. And that you're right about at the point where you could be having an emergency as far as the dog overheating.
Yeah.
So again, proper conditioning and proper surfaces. I really don't care much for walking on pavement, and especially running on pavement. I think it's very hard on dogs. There's other exercises that the dog could do that benefits himself than being on that hard pavement.
Yeah. Well, I can speak from experience. Many years of running on hard pavement and marching in combat boots for many years caused me to have a knee replacement at at a very young age. So I can tell you it's not a good idea to do that.
Yeah.
So there you go. All right. So the other thing I wanted to really address is, because this has come up more as an instructor and with some of my students, is one of the things that we haven't talked a lot about is how do medications affect performance. I'll give you an example. I have a student that has a dog on Gabapentin for allergies, and it has affected her. She's noticing some difference in her sniffing because she doesn't primarily nose work with this dog. And she notices a very big difference when the dog is off of Gabapentin. She'll skip a dose, and the dog is a lot more energized and ready to work when she's off of the GABA versus when she's on the GABA. And I've also heard about some antibiotics that might cause some of those issues. So I wanted to get your take on that.
Yeah, that's really, it's very interesting. And it's there's been some research done, especially on dogs that sniff for a living. And they found that the gabapentin, it affects the nervous system. So again, anything that affects the nervous system is going to affect how the dog functions. We don't know a lot about how gabapentin works. That's one of the things, is that it functions primarily in dogs with nervous system pain. So neuropathies. It's great in people with diabetic neuropathies. So they use that a lot in people. It can be very beneficial, but we really don't know its mode of action exactly. Some of the side effects of gabapentin can be mild sedation, ataxia, so they walk a little wobbly. Sometimes you can get some diarrhea even from it. And so if you think about if it's dulling the nervous system, what's one of the biggest parts of a dog's nervous system is its sense of smell. So it makes sense to me that if it's going to affect the nervous system and dull the nervous system response, that the sense of smell is going to be affected. And so I think that's probably one of the things that we see with gabapentin, that it's going to affect how they move. It's going to affect sometimes their cognition because it affects the nervous system. We don't know exactly how it functions to dull that nervous system response.
Right.
Tetracyclines can sometimes also dull the nervous system. So that's an antibiotic that is oftentimes used. So that can dull the nervous system.
Yeah. So we lost Joanne. I'm not sure where there she is. Oh, we lost her. Anyway, so
I didn't think it was that boring. Oh,
yeah, no, it was great. No, it's great. I think she just got new cable, new internet, so I think she might be having a little trouble with that.
Okay.
All right. So yeah, they use somebody asked about gabapentin for allergies, and yeah, there's a couple of vets using it for
Well, if you think about it, what's an allergic response is a hypersensitivity of the nervous system in a lot of cases,
right.
because you're getting that itching, and so you may have a skin problem, but the hypersensitivity that the dog's responding to can be a nervous system problem because they're itching, and so you want to calm that down so that then you can clear up what the allergy is. So yes, they are using it more and more, and they use it for epilepsy, for treating seizures.
Oh,
They're
yeah.
using it more now for that as well. So there's a lot of things, gabapentin is probably one of those drugs, sort of like aspirin, that if it were invented now, it probably would never have been approved, because aspirin has so many effects and so many things that it can do. The FDA probably would have said, well, narrow it down to one thing that this drug does, and you can't. Aspirin does lots of things.
Right.
So gabapentin's been around for a long time, and they're finding more things that it can function because of it affects the nervous system. And if we knew exactly how, then maybe we could zero in on it even more.
Right. And Judy was asking about vaccinations, how they affect the nose or the performance, because there's some dogs that have gotten vaccinosis and other things from that.
Well, again, it depends on if the dog has a hypersensitivity to a vaccination. I vaccinate my dogs, but I also do titers.
Yeah.
So I do titers to see what vaccines he might need. But I'm not going to take a chance with some of the diseases that are out there.
Yeah.
If the vaccine is relatively safe. So if you know that the dog has a hypersensitivity, then you want to try and avoid that. Or you want to vaccinate the dog at a period of time when they're not actively engaged in the sport. Give them a couple of weeks, because it takes a few weeks for the immune system to ramp up after a vaccination and then settle back down again. So you don't want to be stressing the dog I don't think within that 2-week period right after giving them a vaccination. And I'm a proponent of spreading out the vaccines, a month apart, so that you're not constantly barraging the immune system with a lot of stimulation all at once.
Yeah. I am a big, I do everything that you say in that regard. It's like I space them apart. I separate them at least a month, and I do titer. So if they need that vaccination, they only get that vaccination. And it's been pretty great. It's been very stressful. And now lepto, my young male likes to lick pee. So I've had to give him the lepto shot to make sure that he doesn't get that.
Well, exactly. And there's a lot of horror stories about the lepto vaccination, but I can tell you there's even more horror stories if the dog gets lepto.
Yeah, agreed. Which is why I decided to do that. Other questions?
I like the one about addressing when it's time to transition an older dog.
Yes.
That Amy has written. Sometimes we have to be the adult in the team with the dog.
Yes.
And a dog is going to want to perform for you no matter what. So I think one of the things that you want to look at is the recovery of the dog after they participate in sports. The next day, are they very tired, not quite wanting to move around as much? Again, this is, I think, where videos are very important. Watch how the dog is performing. When you're in the heat of the sport, you may not notice that the dog may not be quite moving as well as it did a year ago, for example.
Mhm.
So look at videos of the dog. I also look at the toenails to see, is there any abnormal toenail wear? Are they starting to drag the tips of the toenails a little bit? Sometimes that's going to be the first thing that you're going to see, is that they're not lifting the feet as well as they should be. And so you'll notice that that is happening, that those little toenails are just a little bit of wear that they may not have had in the past. But I even know, like with Otter, he loves barn hunt. But I've noticed by looking at videos, he's not flying around the ring quite the way he flew around the ring 2 years ago when we started barn hunt.
Right, right.
So I've got to be the adult, and I had to choose what venues to have him at. So like for your canine, you've got mats on the floor. Excellent. I'm good with that. There's other venues that I've been to where they put a tarp over a cement floor or over an asphalt floor. The way he jumps off bales, I can't do that. I've got to be the adult and say, no, we can't do that anymore. It's not good footing for him. But so we're transitioning to making careful decisions as to where we compete and the temperature and that sort of thing as well.
Mm-hmm. Yes, and it's hard to be the adult, especially when the dog physically wants to do it. But I think you can make some good choices for them where they can still enjoy whatever sport, but it's just going to be a little bit more modified. That's all.
So Elena has an actual, a really good one here. What are your thoughts on age to spay neuter? With all the studies out there, early spay neuter, are they prone to more cruciate injuries, musculoskeletal injuries, canine cancer?
Rosemary, she's frozen. So we'll get her back. Hey Judy, to answer your question, most vets now are vaccinating 3 years versus 1 year rabies. Very few doctors are doing any more 1 year rabies. There's a few out there, but it's not very many. Majority of them are looking to do 3 year versus the 1 year rabies. So if I don't know if that helps you, and hopefully we'll get Dr. Rosemary back here pretty soon, because I think she just lost her footing there. Anyway, I'm hoping you guys are enjoying. If there's anything else that you'd like for us to ask her, I wanted to get your feedback on. If this is a topic that you're really interested in, because I don't really think we talk enough about the health and the physical health of the dog and all that stuff. So I just wanted to get that information. Hopefully we can get her back, because I do have more questions for her. But the internet with the wind and everything, it's probably been a problem. But yeah, Judy, definitely 3 year, especially for your young dogs, for sure, because it's really important. I haven't done annual vaccines in I can't tell you how long. And Cha-Cha, I gave her I titered her at 7 years old, and at that time she needed a distemper, so I just gave her the distemper, and that was that. Yeah. Right.
And I'm sure you see it too, Nancy. It saddens me so much. It's mostly, beginning obedience folks that come in and they give us their vaccine records, and they have, 5, 6, 7 vaccines done all on the same day. And it's just so hard on those dogs.
Right. So hopefully we'll get her back, because I know we lost Joanne there for a second. So hopefully Dr. Rosemary can come back for that. So we'll get that information. But yeah, I wanted to thank you for all the feedback, because we'd like to keep doing more of these. Next week, we're going to do some interviewing on titers. What titers are is it's a blood draw, and they check to see the level of the antibodies for rabies, distemper, and parvo. And if there's a certain level of antibodies that the dog should have, and if they don't, then they'll vaccinate the dog if it's below a certain amount. And then also, and then if it's fine, it's fine. So like I said, at 7 years old, Chacha needed to have her distemper redone, and that was it. So yeah, it's a blood draw that they have to do for the dog. So that's that. Anyway, so next week we're going to have another interview set up, and so we'd like to get that feedback from you of what other kind of topics would you like to have people talk about, right? Not just us, but other people, like other topics or other professionals that are doing some of the other wonderful things that you'd like to learn more about. One of the things I'd like to personally learn more about is different topics and different dog sports and everything like that. So I think we have Dr. Rosemary coming back online, so we'll get her back. And I think
Here she comes.
Here she comes. There she is. Yay!
I was happily talking to myself.
Yeah. Yeah. Well, I think with the wind, the internet's and the internet's so full, it's really hard. So somebody asked about how much exercise you should do with a young puppy.
Ooh, how old's the puppy?
Lisa, how old is your puppy? I think maybe 4 or 5 months old.
Yeah.
And Melanie's puppy's 10 months old.
Okay.
So how much?
So you want to be very careful with puppies. You don't want to do any kind of impact activity. You want to be careful with jumping, with forced running. They're going to run and play on their own. Dr. Zink's got a great outline that I could provide that for you, Nancy, and maybe you could get it out to your folks.
Yep.
That gives age appropriate activities for puppies, but you don't want them jumping anything higher than their wrist until their growth plates are closed. And for big breed dogs, like say Goldens, Shepherds, that might be 18 months or longer. The last growth plate that closes is the one in the knee at the top of the tibia, the shin bone. So you don't want to be doing impact because you don't want to screw up those growth plates. You don't want to be doing a lot of twisting and turning, forced. I mean, they're going to do it on their own when they play, but you don't want to be doing weave pull when they're very young, because you're putting a lot of torque on the growth plates of the spine. So you want to be age appropriate. You want to be doing nice basic training things that are, sit, stay, heel, the commands that could save their life, like stop, come, those kinds of things. But I'll get you a link to Dr. Zink's
puppy
idea. She's got a real nice chart on working with puppies.
Yeah. And Elena asked about spaying and neutering recommendations. I know there's a lot of information about that. I kind of am more of waiting till they're a little older to spay and neuter, but we've heard some things about if you do them spay and neuter too early, there's more potential for cruciate or cancer. So we wanted to get your opinion about that.
Yep. So I'm in the camp that if you don't need to spay or neuter, hold off at least until they're 18 months old, if possible. Minimum of a year for a smaller breed dog, exactly for the things that you said, that we're seeing that there are more orthopedic problems, especially in large breed dogs. Again, Dr. Zink's got some great articles, some retrospective studies that are out there on the problems that have happened with dogs with increased hemangiosarcoma, increased orthopedic issues if the dogs are spayed or neutered too young. And of course, you know, when I went to vet school, we were taught spay and neuter before they're 6 months old. And that's not necessarily the thing that we're looking at now, but hard to change old habits that have been out there for umpteen years.
Mm-hmm.
But I'm a proponent of waiting if possible. And then there's a school of thought of then do the ovary sparing. So just remove the uterus and leave the ovaries, leave the hormones. Much like a woman, they want to leave the hormones in place. If a woman has to have a hysterectomy, they don't do an ovariohysterectomy on a woman unless there's a problem with the ovaries. But then you have problems with the dog still shows heat and that sort of thing, which is one of the big reasons why people want to have their female dog spayed. They don't want to have to deal with the heat cycles, especially if you're in competitions, because then you can't participate in most dog sports if the female dog comes into heat.
Right. Because they still would be, so I think, because I talked to Lori about this too, because I was going to do an ovary sparing for my female, but I ended up doing a full spay because I have an intact male too, and it was just it was just too much to deal with. So I know that Lori's dog, she doesn't have that issue, but so they still go through their heat cycles just like they would if they were. There's just no blood, right? That's the difference.
Right. There might be a tiny bit of discharge, but
Okay.
it depends on whether the whole cervix, you know, theoretically the whole cervix should have been, you know, the whole uterus should have been taken, so you shouldn't have any kind of a stump left or anything like that. So,
Okay.
but they might have a tiny bit of discharge.
Mm-hmm. All right. All right. Joanne, are there any other questions that we've missed?
I don't think so.
Yeah, so waiting until they're older, blah, blah, blah. So then my other question I wanted you to talk a little bit about was the different modalities in like chiropractic, acupuncture, you know, what supplements that you're kind of really interested or that you highly recommend. I know one of those was fish oils that you talked about, but what are some of the modalities and what are some of the benefits to each modality for our dogs?
Okay, great question. I'd start out with the spinal manipulative therapy or the chiropractic. I think that's going to benefit everybody because done by someone who's properly trained, they're going to find very slight hypomobilities, very slight changes in the way joints move that may not be showing any kind of clinical problem with the dog. So you're going to find issues and be able to work with them before there's a problem, before there's a lameness, before the dog shows any kind of a gait abnormality. So that's the number one thing that I really like. For supplements, fish oil, like you said, the EPA and the DHA are the two components that are the most important in the omega-3. I kind of, as a rule of thumb, I look at a dog and I say that the dog should have 15 milligrams of DHA per pound per day. And then as long as that's the ratio, you're going to get an appropriate amount of EPA because the DHA is going to be in an amount that's going to bring enough EPA along. The thing is, over-the-counter products, there's no control. So if you buy a product over the counter, it could say, oh, it's got 1,500 milligrams of whatever. And if you actually tested that product, it might have nothing. So unless the product is tested by a independent third-party testing laboratory and that's certified, you can't guarantee that an over-the-counter product is going to have in it what it says it's going to have in it. So you may be giving it to your dog and you're saying, oh, but it's a lot cheaper than this other product, but maybe it's not doing anything. Or you give it to your dog and you say, well, this stuff doesn't work. It's no good. Yeah, but maybe it didn't have in it what it was supposed to have in it. So that's an important thing. there's not a whole lot of actual science research on glucosamine and chondroitin. That we think that it helps, and anecdotally it seems like it helps, but sometimes some research says, well, we don't really see where it's affecting the joint or it isn't affecting the joint, but it's not going to hurt. And so I do give my dogs glucosamine and chondroitin supplement. I like the Dasaquin Advanced as a supplement. What else? Fish oil, Adequan. Now that's a product that has good science behind it. It's been around forever. It is an injectable product, but we teach the people to give the injection themselves at home. Give the injection under the skin. The label says it's for in the muscle, but it will sting really badly when it goes in the muscle. And the reason why it says that is that's where the testing was done years ago. But now clinically, we know that if it's given sub-Q, it doesn't sting, and it's probably nearly as effective, if not as effective, as if it's given in the muscle. So I'm a big proponent of Adequan for a chondroprotectant or a product that will help the cartilage, protect that cartilage and the development of the cartilage to help prevent injury.
That's great. Yeah, I use that Adequan for my older dog. Oh, go ahead, Joanne. Sorry.
Do you have a particular fish oil that you know is or a couple of them that you know are good and tested, and she's getting one now?
She does. That's the one that I use. After we saw Dr. Rosemary, I started putting the dogs on it, and so it's great stuff.
This is the product that my guys are on. It's Omega Benefits by Veterinarian Recommended Solutions, vrshealth.com, I believe. I also take their human product. I took their human product before I put my dogs on their veterinary product because I wanted to see how it worked. And I used to take Nordic Naturals, which I also think is a very good product that you can buy at a lot of health food stores. I think it's a good product. I used to take their human line, but a lot of fish oils I would belch like a perch, and I didn't like the taste. It upset my stomach. But I've not had any problem with this other product. The human line is physician recommended nutraceuticals. So I take it and have absolutely no issues with fish taste or upset stomach. And I don't get a lot of fish breath with either Otter or Duncan. And they take the Omega Benefits twice a day. So that product I like for the fish oil. And I think Nordic Naturals is a decent product as well.
Okay. What about krill oil?
You can use krill oil. I think the fish oil is absorbed better from what I've been reading, but the krill oil is also a decent product. If there's a reason why you can't do the fish oil. I think I've had a couple of clients where the dog has actually had some allergies and they do well. The thing that I like about the VRS product is it's very purified. So even the liquid that comes in liquid or capsules, even the liquid, when it's in the fridge, it's in a pump bottle so the air doesn't get in. And when you get to the bottom of the bottle, it's still relatively clear, whereas some of the fish oils, when you get to the bottom of the bottle and the liquid, it starts to get kind of cloudy. And that's usually impurities that are in the product from the processing procedure. So yeah, krill can be used, but I think the fish oil is a little better absorbed by the dog.
Okay. And then I know one of the new ones that's out there. How do you feel about collagen for prevention and arthritis and those types of things?
I don't know that there's been a lot of research on that as far as taken internally. I know people use it for their uses. I don't, obviously. But they have had some good results, topically. But I don't, to be honest with you, I don't know a lot of the science behind how it would function internally. I haven't read a lot of good studies.
Okay. All right. Does anybody have any more questions? This has been so great. It's been wonderful. The internet is our friend and our foe, but we've had we're pretty good.
There was one more question that I think would be really good to maybe end on.
Yeah.
Okay.
They asked, how do you find a reputable chiropractor or rehab for your dog?
Oh, wow. Good question.
All righty then. Who has been trained appropriately in veterinary chiropractic or veterinary spinal manipulative therapy. So you can look, the Healing Oasis has a list of their graduates, and that's where I teach, so I'm going to be biased at that program, the Healing Oasis in Wisconsin. So it's healingoasis.edu, because we are an educational institution. The American Veterinary Chiropractic Association also has a list of people who have been certified and trained in veterinary chiropractic. I know at the Healing Oasis, we train both veterinarians and human chiropractors because there's a difference in the anatomy and how you adjust a dog versus a person. So the veterinarian needs to be trained because they've never been trained in chiropractic techniques. And the chiropractor has to be trained because they've never been trained in animal anatomy and some of the problems that can mimic issues that may not be a chiropractic issue. So that's why it's always important, in my opinion, to have the veterinarian look at the animal first, and then hopefully they can refer you to a well-trained animal chiropractor, veterinary chiropractor, or spinal manipulative therapy. But those couple of websites could at least give you information as to finding some people who have been trained. And you can always contact the institution like the Healing Oasis and find out, who are their students. If you can't find them, graduates, their graduates on the website, or the American Veterinary Chiropractic Association if you don't find someone nearby.
Awesome. Thank you, Dr. Rosemary. It's been fantastic. Thank you all for joining us. It was really fun and very informative. So this is the first of many, because it seems like we're going to be on lockdown for a little while longer. So we're going to try to do more and just keep our brains engaged in other things. So thank you again.
Oh, let me just, one more thing. One other, the College of Animal Chiropractors, COAC, that's another group that you can look online for veterinary chiropractic.
Yeah. And the videotape, this video will be available on Joanne's Facebook page, For Better For Worse, and For Your Canine Facebook page. So you should be able to go in and download it and watch it again in case you wanted to get more information or if you missed something. So thank you so much, and we'll see you next time.
Appreciate it.
Thanks to Dr. Rosemary, and thanks to you guys for listening.
You bet. Thank you. I enjoyed it.